I am your host, Nicole Will, and we're so happy you're here as we navigate the world with your aging loved one. We are here to come alongside older adults, family members, and the senior living community as we explore the world of aging and elder care with helpful resources, informative interviews, and approachable conversation. We get to do this together, so join us on our journey, and this is the Will Gather podcast. How do we keep track of all of our health information stored in multiple locations? There are numerous health records and documents that need to be collected from multiple doctors and providers. My guest today is Jean Ross. She is the co-founder of Primary Record. Primary Record is a safe and secure way to organize, discuss, and easily share your health information with those that matter. It's a mobile application that all families need. It's a necessity for individuals and caregivers of those living with complex medical conditions. Jean spent 6 years in critical care. She was able to see the frustration that this disconnected health information was causing families. Primary Record is the future of how families will access health information stored in multiple locations, and the importance of how utilizing tools like this can help family caregivers save time. Jean shares with us what is happening in the world of health information. Family caregivers manage many aspects of their loved one's care, and most importantly, their medical information. Just sorting and keeping track of all of this data is an undertaking. What is all included in our health information and how Primary Record can help us with that? Families are excited about having access to this medical home base. It allows them to share their health story in meaningful ways with their providers and have the ability to tackle and coordinate care for their loved ones. Jean and I had the opportunity to meet at the Care Colloquium and interview in person. It was a joy to meet her. Here is my interview with Jean Ross. Hi, Jean. Welcome.
Oh my gosh. Thanks for having me, Nicole.
Thank you for being here. This is so fun, and I finally get to meet you. Been connected for a little bit professionally, but meeting in person, having a time to actually get to know each other and share. We are podcasting live from the Care Colloquium.
Yay!
How's it going for you?
It's overwhelming. My brain hurts because there's so much conversation. There's so many inspiring people, so many people doing so many great things. And I'm an introvert by personality, and which no one ever believes.
I am too, and everyone's like, "What?"
Yeah, I went to the library and I got my book because I knew after once the conference was done or colloquium. Sorry, Kimberly.
Yeah.
I would need to go to my room and read. But yes, it's I cannot wait to. I have a drive home, and that will be time for me to process and figure out what is this next step. This is like a beginning of something.
I think so too. There's this energy here. I think everyone can feel and sense that there's going to be the momentum is here, and it's starting and it's growing. Has there been anything that specifically stood out where you're like, okay, that's like a huge thing I learned, or a takeaway, or something you're excited about?
No, I learned the challenges of employers, which wasn't something on my radar because I've been so focused on family caregivers and then kind of in the medical space. So understanding the challenges on employers and the growing hardship of caregivers in the workplace, that was been eye-opening. Tia of Caringbridge was a phenomenal person to meet, so down to earth, also an introvert.
Yeah.
And
all of us introverts
I
are
know,
coming
right?
together.
Yeah. And just so cool to see, they're seeing as well, numbers growing, more need, and just trying to make those connections. And it's wonderful that everyone's in their headspace trying to figure out what's the next step of helping people, because we're seeing more and more need.
Yeah,
But
absolutely. Yes. There is so much conversation too around how do we support family caregivers. You have a unique perspective because you're coming at it from a clinical background and now also in the electronic health data space. I want you to share your story, and I want you to share with us, how did that come to be for you, where you saw, okay, this is something that we need to tackle and start to look at?
Yes. So if you are a nurse or a doctor and you can log in to your EHR, your family caregiver cannot. And I did not realize that. And I wish someone would have told me that because I kind of would judge families. How could they not know this about their family member when I was a nurse in critical care? And I had this moment in critical care where we had a lot of 80-year-old plus patients, and it is the worst place to die. You know, so I left that space to go figure out what was missing in the community. And so that was in 2016. I remember putting on my phone a countdown timer of January 1st, 2026, because at that time in 2015, I thought the first baby boomer turning 80 was going to be the devastation of the healthcare system.
Yeah.
Whoa, 2020. I kind of proved me wrong, right? But right, but it's to me because no matter how healthy you've been, your heart is aging, your brain is aging, your bones are aging. You start using more and more healthcare, and I was seeing as a nurse, we don't have stuff together. So I went out in the community. I put in a website, but I always say like a sign in my yard that said, "I will be your nurse care coordinator." No idea what that meant. No idea what kind of phone calls I would get. And when I did get my first phone call and I showed up, the family doesn't know health history. They don't. You get medication pills. You get, oh, I had this procedure. I don't remember what they did. And so I couldn't effectively help my families until I learned. And what was beautiful about being a nurse, we are like the profession people trust, right?
Yes.
And so they would trust me and they would hand over patient portal accounts, their claims data, and anything I could get my hands on. And I would, for the first time for that family, pull together this story. Right? I would show them, here's your conditions, here's the medicines that are on, but then I would take that, a big part of my business was going to medical appointments. And I would take that story and then I knew how to advocate for my older adults. And I was really excited about this. Things were going well. I had 9 nurses because I believed like nurses were going to change this model, right? Not really thinking through scalability and the hardship of service-based industries. I was just idealistic because I saw a need and I saw a way to help. And 2020 hit and I had 9 nurses ready and then everyone stopped going to medical appointments. And so I had to pivot and I had to look back to understand what were the things that families found valuable? And then I realized too, as more nurses were quitting, there wasn't going to be enough to scale this. And I realized so much is on that family's shoulders already. What can I do to help that health information? What could health information do? Because when I remember this one client, I was so angry because there's all this data. And if we knew this data, we'd know how to help them.
Right.
But yet the data is being used to bill your insurance, to make sure that you got the right outcomes so Medicare will reimburse, or, it wasn't being used for the family. And so I'm very fortunate to live across the street from a brilliant person in technology, Jim McIntosh, and he has a daughter with Down syndrome. And so 2020 for him meant one of them had to stay home because virtual school was not going to be possible for Mia. And I've given him 100 ideas over my 6 years. Because this is a growing market, right? Yes. Everyone's getting older. There's, Jim, people can't find resources. People can't do this. And he would do his little tech evaluation and be like, But then I showed him the apps I was trying to use, the Google Drives I was making for families, the conversations, the value that families were telling me. And that's when he finally told me, I think you have an idea. Wow. And when we dug in, we learned that at the same time, there are laws changing because family caregivers are the health information is so inaccessible, and so there is laws that, from the Cures Act changing, and so you had information blocking that went into effect around 2021 that now just became full effect in October of 2022. So we're at the very beginning where this new law is saying consumers have a right, or patients or families have a right to put their health data, to request it electronically and put it into any consumer app of their choosing.
That is game-changing for you guys.
It is. Yeah. And so we're riding on this kind of front wave, and there's a lot of work to be done in that space because one hospital calls it first name. This hospital calls it surname. So we have partnered with One Up Health, who's done the hardest part of the work of making the responsibility of getting the different contracts in place with all of the health networks. And through them, we're connected to 10,000 patient endpoints of data that families can now use our service to go behind and pull down. And we're going to use that to help them have this one place to what we're going to call family medical home base.
Yeah. So. Yeah, incredible. Yeah. And so needed. Even when I personally, just for myself, go in to my doctor and we have our annual and I have to resubmit again all of my, maternal and paternal health history year to year, I forget. Remember some of the big stuff, but then I'm like, oh my gosh, what was that?
What date did it happen?
That.
Yes.
What's the date? I know I had surgery. When did that happen? It's like I can't even manage that for myself, let alone when you're responsible in managing children and mom and dad and all that goes into that. How has it always been typically done in the world of health information, or being done now, but we know that there's a new way? What makes how we're doing it now so not efficient?
It's all pretty new, and and new in the healthcare world is like 15 years, right? So when I became a nurse in 2010, there were still bickerings among the older nurses about moving to electronic charts,
yes.
right? So we just came out. I mean, I was starting a nurse, and I was excited for electronic charts. They seemed efficient and awesome and whatnot. But I mean, you went from patient charts to electronic health records. And I think there was a big missed opportunity because we were just replacing a patient chart. We weren't thinking about how would data need to flow through the system. And then there's also the rules around HIPAA, right? And there's a lot of misunderstanding around HIPAA. So when I'm a patient going into an office, data is made about me. And when I leave that office, HIPAA is there to protect me, so however that office is sharing it. And so a lot of consumer apps are not HIPAA, even though they may tell you they're HIPAA protected, because it's like having protection on your file drawer at home. You know, how we're doing it today with the information blocking, what I'm seeing is a lot of health systems don't know what to do. So everyone's just making a patient portal. And for my family that's healthy, quote unquote, I have 3 sons, a husband. I counted, we have 15 accounts I would have to log in and to go find information of when was that last vaccine. I have to go log into my little clinic.
Yeah.
When was, their last pediatrician appointment? I have to go log into this one. Like, there's not even data on what the average health, family, how many portals they manage.
Right.
I can't find that statistic. If anyone has it,
Yeah.
please let me know, because that's the answer. And so what I tell folks all the time, because people are like, well, I have a patient portal. And I'm like, and that works wonderful for a lot of people. But when you have someone who is aging, or you have a child with a rare disease that requires you to travel 200 miles to another city to have the specialist you need, this is why families are making binders. And they're printing out from all their portals. They're writing their medication list, because there's not a good way. There's 100 apps about it, right? But most are using just a handwritten list or typing it out themselves. And they're vigorously writing notes, because then what we also learn from our families is the EHR system is trying to make those doctors efficient, and so they click through it. But they're telling families some wonderful education or resources or things they should do. And the family thinks they're going to go back to their patient portal and see it, but they don't.
Yeah.
So then they have that moment, and then they learn they have to start taking notes. So then hence the binder.
Yes.
And so that binder is literally, to me, if I start seeing binders go away, then I don't feel like I need to make primary record. But as long as there is a family holding a binder, then I know we haven't solved the problem for family caregivers.
Yeah. I have a binder.
I have a very disorganized file drawer. I'm really embarrassed by here I am supposed to be the guru of a healthcare organization, and mine's in a file drawer. So kudos to you for having a binder.
Well, and we'll get there, and that's where you saw this huge need and having everything in one location. Because I think the common theme in the conversations that I'm having this week is that we already have so much on our plate, and there's so much our mental capacity can take care of. And when we have systems that make it just a little bit easier and alleviate a little bit more of that burden, we're going to be set up a little bit more for that success and to ease that, which is so, so helpful. And there's so many family caregivers that manage, like you said, many different aspects of care, medical information, sorting, tracking. It's such an undertaking. In what ways does primary record actually kind of walk families through that organization system to save them time and alleviate some of those concerns we were talking about?
Yes. So we ran a beta. We put together what we, from what I needed to run my business, right? And we talked to 100 families, and I always told Jim I wanted to start a hashtag that said "Show me your binder."
Yeah.
And so we talked to families, show me your binder, how you organize it, why do you keep track of this, what do you need, what do you wish this had? And so we built a little beta pilot, and we were excited about it, but a lot of I think a lot of caregiving apps, you have to look at saving family time, and ours was all manually entry, and it was overwhelming. And, families were telling us, like, I don't feel like I'm the one that knows the condition name. How am I supposed to put that in? So we knew we needed to integrate. And so that's where we spent another year and a half learning how to connect families to that patient portal. Because for me, what my dream is that we can have a place to start. And I'm not going to fault the family member for not being prepared, right? I don't know anything about cancer. I'm not going to research cancer until I have a problem with cancer. Exactly. Then I'm going to become an expert. So when I finally have a need and I start that binder, I want families to have a way that's easier than it is today to link all those portals and hit a button to just start. And then from that start, the information comes in, and it's really cool to see behind the scenes. I'm learning words like JSON and API and all these words that are not in the nursing field, right? But from that the way that technology is written, I can then use my nursing lens, and then I tell my development team, okay, this needs to go into conditions. Oh, we can link, here's the provider, link that to the provider so the family can have a view. So we're going to do that organization for you. And there are people doing some aspect of this, the whole bringing data together. But what they're missing the mark on family caregiving is I also have this information I need to put on top of that data. My voice matters too. My observations matter. My interpretation of what's happening. So alongside, we always say, it's to organize. It's to make notes and tell your story, or make edits that are happening to that health information, because it only gets updated when you go visit the doctor again.
And it changes.
And it changes evolves, at home, right? Or it's changed by another doctor who doesn't speak to this system. It's a mess. But for us, it's looking at any way I can to save time for families. So we worked with Hamilton Southeastern's they have a great technology program, and we used some of the students. And students showed me, and I mean, Jim's talked about it, but to see it live, you could aim and take a picture of a medication bottle, and then that would just populate in there. Wow. The more I can eliminate manual entry, the more that I can just help link the information to suddenly that's the doctor I need to call. Or we started with doctor list, and we realized, no, it's care team, just like Amy Goyer was saying. Yeah. Right? Like I need to have one place where I can put the dog walker right next to the cardiologist and anyone. So if my sister's helping that weekend, she has one place to go to find any information. So it's, how do you save time? You integrate where caregivers are. And the other beauty is we're looking at when you go to upload a visit, Jim always tells this story. The dream is you make a call, you make an appointment, it refreshes in primary record, the visit shows there, but then it links to your Google Calendar, so it's already populated.
Oh my gosh. Wow. Just like a simple step that helps so much.
Right, because if not, it was you then putting it into that app, then you going to your Google app, right? And I was doing that as a nurse, when I was trying to run this care coordination, it takes a lot of time. Yeah. And that's not what family caregivers have.
It really is the perfect marriage of the nursing clinical side with the tech, because I think we don't always know what tech's capable of if you're not from that world. And then you can share, okay, here's what families are dealing with. Here's what I've experienced. And they're like, oh, we can solve that. This is how we do it.
I know.
It's like, oh, really? I didn't even know that was a possibility, but I'm so glad it is.
I know. That's my everyday. And I'm like, we can do that?
Yes. Oh, good. And that you're just, posing those questions. So what's all included when we talk about health information, just so families, I think, can really see it or visualize it with primary record that can help with? So you talked about appointments. What else is in that list of things that
when
we
the development we're doing now, because we're I want to make sure this is valuable before we try to do all of the connections that we need to do. So when it launches in January, a family would be able to integrate with the portals, and they could put in medications, visits, and then build that care team. But the other data points that we're looking at are vaccinations, labs, tests and assessments, so like your imaging, your mammogram, as well as just files, and that's where you can do the legal, right? The end of life form, so you just always have it on. You don't have to worry about a piece of paper, right? I'm trying to think. And the other thing, which it's been fun talking to people, because everyone has a story with this, and they're like, well, not all of the care I do is medical. Like, what about, I do this for my parent. And I'm like, that's the beauty of the flexibility of primary record, is you can integrate it there, but you make it your story. So if you take, black seed oil to sleep at night, just please put it in, because that helps your healthcare team, because they can check for reactions and whatnot with drugs that you're on, right? Like, it's not an EHR. It's more for the family to tell their health story, and just having a place to keep it all together.
I love that you keep coming back to the word story, because that's what it really is. And it is being able to then effectively share that story when we might not have the words to do that, or equipping people that can share our story for us.
No, and that's what we realized, because we're like, well, what has made this a need? And back in the day, there were people that were complex or whatnot, but even today, I can have a primary care doctor, but then I'll see them, and then I'll see their nurse practitioner. And it's not a transfer of knowledge from that doctor instantly, that nurse practitioner. You have to retell your story. Yeah. And then I go to the ER, and then and so what we realize, and that burden on the families, if they get it wrong, that's what I would get from my caregivers, this emotional beating up of not getting the story right, or saying it in a way where it didn't effectively advocate. That's where I rely heavily, and the piece that Jim and I speak to, as well as, unfortunately in medicine, there is bias. And so if I can make something that helps tell their story in a fancy way that I know doctors will tune to, right? Like me telling you I've taken my kid 4 times to ER, something's wrong, not right, right? But if you can print out a summary for that doctor, and it displays that data, like that is game changer, because I've seen that.
And it does that?
Yes. So,
oh my goodness.
It's the idea to share your story. Share your story is very, and I don't do it justice, and I'm sure my business partner will be listening and being like, dang it, dude.
We'll tell people where they can learn more.
No, exactly. And so sharing is this idea that you can invite, if you're, this one story that hits us is one of the moms has a daughter with a complex condition and never feels like she can leave. But now her mom has access. She can invite her mom into primary record and then know she has all of the access to the information to answer if there was an emergency, right? It's this freedom of being able to share your story with whoever in your family. We even tested, Jim used another nurse care coordinator. She would take his mom to the medical appointments. And so it's this ability to share by inviting people in, as well as getting the information out. So I'm married to an emergency physician. We have lots of friends that are willing to consult for us. Like, tell me as a cardiologist, if you got a new visit, what do you need out of primary records? So then we can just customize. And so it's like, new doctor visit, what's the specialty? And we can pull, if you're maintaining that information or pulling it together, help you share that. That's what I geek out about as a nurse, because I was the one on the admissions trying to put the data into my EHR. And it's hard. Yeah. It's so hard if that family doesn't know their own story.
Right. And you were probably trying to pull out what you could with the limited information they might know. And family caregiving is becoming so, and I feel like it's been this way, but it is that team approach where we're pulling in, there's multiple siblings or multiple kids, and being able to effectively have everybody on the same page so that we don't have things fall through the cracks and feel bad about it, like you were talking about. So it's so valuable, and I'm so excited this is coming and out there. And how can people learn more? Where can we get started? How can we sign up?
Yes. Yeah. Oh, thank you. I appreciate that, Nicole. So we're at primaryrecord.com. You can learn more. And I think on our up in the corner on the menu, you'll see join the mobile app wait list. We don't send a lot of emails. We're just curious. If you're interested, we want to know about it. And then we'll communicate along the way if there's any delays. But our hope, and you'll be one of the first to learn about the app in the store. And there as well on that website, you will see how it works. Because when I learned that through our partnership with One Up Health, that I can help families have a summary instantly. So you can see how it works. You can click through to find your healthcare portals, connect multiple, and then hit a download health summary. And please let me know how helpful, not helpful that is. Me, and then I'm Jean at primaryrecord.com, and I want to hear from you. I want to know how to do better, because I am 100% behind how to make this better for family caregivers. And a lot of people doubt that, and which makes me more stubborn.
Exactly. You're like, I'm doing it.
Tell me I can't, and I will.
You have a heart of gold, and you're warm and kind and have a smile on your face. I know people can't see you, but I hope they can feel you, and you're just charged to want to make this better. So I'm so happy you're here. And
thank you for this opportunity.
Yeah, absolutely. And the website's beautiful, by the way. I went tinkering around in it, and I thought it was easy to navigate. I was able to gather some really good information, and I think just that clearness for families
that is so important. The transparency, right? Like if you have a question that's not answered, like let me know. And I'm happy to share. I'm an open book in this whole process because I'm a firm believer families need to have access to their own health story.
Yeah.
So
and here we go. And so it is.
Yeah.
Yay. Thank you so much. Thank you for listening today. If you enjoyed our episode, please subscribe and give us 5 stars. In all honesty, we'd love to hear from you. Thank you so much for listening to our episode.